bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Our guest this hour is Keely Cofrin Allen with the Utah Department of Health. Welcome.
Thank you.
Nice to have you here.
Nice to be here.
You want to talk to us today about the Utah All-Payer Database. What is that?
This is a database of claims data from health plans that will allow us to look at costs of care for the first time in the state of Utah.
Healthcare costs, then, is what we're looking at.
Yes, both what the insurance company pays for your care and also what you would pay out of pocket as a consumer, your deductibles and your co-pays.
Okay, and is this a new thing? Is this a new effort?
It is new. In Utah, we are going to be about the 6th state in the nation to have an all-payer database, and this is a new Utah initiative that was funded by the legislature in 2008.
And why are we doing this?
We're doing this because the legislature believes very strongly in transparency of healthcare, both in terms of cost and in terms of quality. And cost and quality together make value. And what we're looking for is to find a way to help consumers find high-value healthcare, low cost, high quality, and to have those costs apparent to them up front rather than hidden from them, which has been the case up until now.
That's the problem with the whole healthcare debate, isn't it, Keely? That people just don't understand why it costs so much and so forth.
It is. It's very confusing, and the reality is that nobody really knows what it costs now, and this can be very exciting to have a way to look at costs for episodes of care for some of the most important types of health care that people get in the state.
How long is this going to take?
Well, it's an ongoing process. We are getting data from health plans right now as we speak. We have about 75 million records in the database now, and we're putting together a pilot data set for the legislature in January. And it's going to be an ongoing thing. We'll continue to improve it and to report on more episodes and more costs.
And how will this be available to the consumer? How will it be made available to the public? When are they going to see a benefit from this?
We're hoping to start putting out some preliminary reports in the spring of 2010. We're hoping eventually to develop a website along with the health insurance portal to put information on a website that consumers can go and say, well, I need a mammogram. Where are some of the options that I have to go to that are close to my home, that are high value and low cost? What do I expect my out-of-pocket costs to be so that I don't have a surprise 2 weeks after the procedure?
How does this mesh, Keely, with the national healthcare debate? How is it going to come together with that? Whatever that ends up being.
Right. There's a lot of moving parts to the national healthcare debate, and Utah has an important role to play in that. And I think Utah also has its own ideas about how to do things, but transparency is very important. I think until we can make the system transparent, until consumers can shop for healthcare the way they shop now for other things that are important to them, then it's going to be very difficult to change things. Once consumers are educated, then I think that they can provide a powerful force to reform the system.
Now, one of the issues that is almost certain to arise is privacy.
Yes.
How do you protect patient privacy while collecting all of this data?
Of course, we have one of the most secure data sets in the state of Utah. It is very secure. I don't want to go too much into the ways that we're keeping it secure.
Sure.
For obvious reasons, but this is not connected to other things. Nobody has unfettered access to the database, and everything is encrypted. So when we get data from the health plans on a person's care, we can't actually see that information ourselves. It's hidden.
So there's nothing that the consumer needs to worry about in terms of personal information being out there for everyone to see.
Absolutely not. Anything that we would report would, of course, be at a health plan level or even provider level, but nothing at the patient level. And if there is only one case of something in a county, then we wouldn't report that, obviously, because of patient privacy concerns.
The goal then is high quality health care at a lower cost.
Yes, the value proposition, to find a way to get the best quality of care at the lowest out-of-pocket cost, and I think that's what everybody wants, and we're hoping to try and help the consumers and provider community to get that for Utah.
I hope it works.
Me too.
Our guest has been Keely Cofrin Allen with the Utah Department of Health, and I'm Don Olson for Comcast Newsmakers.